Welcome to Dental Shots. I'm Dr. Mohanapriya. Today we are going to see about 2D glucose. So in this video we are going to see what is this 2D glucose, how far it's different from normal glucose. The second thing, what is the mechanism of action, and what are the other fields this 2D glucose have been used earlier, and now how this 2D glucose has been used in the moderate cases of COVID-19. The abbreviation of 2D glucose is 2-deoxy D glucose. So now we are going to see how this 2D glucose has been manufactured. So how far it's different from normal glucose. If you see a normal glucose in its second position, first position, second position, it has a hydroxyl component. But in the manufacturing of 2D glucose, it has been deoxygenated, that is, the oxygen has been removed from the second position, and hence it is called 2D glucose. The second position, first position, second position, it has only the hydrogen atom. Okay, so the oxygen has been removed. The oxygen has been removed in the deoxygenation process to get a 2-deoxy D glucose. So this is the modified form of glucose. It's a modified form of glucose. Okay, as we all know, the glucose is very much important for each and every cell in our body, starting from the cell growth, cell multiplication. Everything is need of glucose. Why it is need of glucose? The glucose is the major component of energy in our body, and hence for the cell growth and multiplication, the energy is very important. For this energy to be derived, we need glucose. So let's see how any food material, most of the carbohydrate are generally glucose. Even if you take a protein or a fat, it will ultimately get converted into glucose, and then that glucose energy will be utilized by the cell for the survival. If the glucose is not entering the cell, then it would be ultimately lead to a cell death. So let's see, if you take a normal glucose, the glucose will enter the cell. Consider this as a cell. Okay, so to enter the cell, the glucose needs some vehicle. So that vehicle is called glucose transporters. This glucose transporters helps in the transportation of the glucose into the cell. So the glucose enter the cell. As soon as the normal glucose enter the cell, it is acted upon by an enzyme called hexokinase. So this hexokinase converts this glucose into glucose 6-phosphate. Again, during this process, a small amount of energy is being released. So this energy will be used by the cell for the growth and multiplication. And after the glucose 6-phosphate, it's been acted upon by glucose 6-phosphate isomerase. It's an enzyme which is acting on the glucose 6-phosphate to get a product called pyruvate. During this process, there is greater amount of energy which is released. This energy is being utilized by the cell for the growth and multiplication, and as well as for the cell survival. So this is the process, how the glucose has been converted into energy, how this energy has been used for the cell survival. Let's see how this modified form of glucose, that is 2-deoxy D glucose, how it enters the cell and how far it's going to act on the cell. Let's see. Consider the same 2-deoxy D glucose can also be taken as a normal glucose in the oral route. So consider this as a cell. So into the cell, the same glucose transporter is going to help for the transportation of this 2D glucose into the cell. So the 2D glucose enter the cell, and after that it is acted upon by the hexokinase and get a 2D glucose 6-phosphate. This product 2D glucose 6-phosphate act as a inhibitor. So this act as an inhibitor for the enzyme hexokinase, as well as this product is going to inhibit the enzyme glucose 6-phosphate isomerase, and hence since it is blocking this enzyme also, there will be no pyruvate formation, as there will be no energy is derived with this pathway, and hence this glycolytic pathway, the breakdown of glucose as it normally occurs in the normal glucose, will not occur in the modified form of a glucose, and hence this deoxyglucose is inhibiting the glycolytic pathway, and hence there is no energy. There is less energy can be derived from other pathways, from the fat and protein, but still the energy derived with this process is being blocked by this 2D glucose 6-phosphate, which is acting as it's a product inhibitor. This product is inhibiting the hexokinase as well as the glucose 6 isomerase, and hence the energy released is being abruptly stopped. And also there will be an accumulation of 2D glucose into the cell again and again. This accumulation again will block the energy production. So there will be no energy production. So the energy cannot be utilized by the cell will be deprived of energy, and hence they will stop the cell growth, and also the multiplication of cell will be inhibited by the 2D glucose. So far we have seen what is 2D glucose, what is the mechanism of action. Now we are going to see what are the fields the 2D glucose has been used. Especially it has a major role in the treatment of cancer. It acts as an anti-cancer agent. So how this 2D glucose is acting as an anti-cancer agent? For any cell, as I told, it will grow and multiply. But when you have a cancer cell, it grows 20 to 30 fold when compared to a normal cell. So it needs more energy for the growth and multiplication of cancer cell, need more amount of energy. So for the energy to be derived, it needs that glycolytic pathway. So when you use this 2D glucose, as I earlier mentioned, when a person who is cancer surviving, we are going to give this 2D glucose in the oral route for a cancer patient. So this 2D glucose enter the cell and will be converted by hexokinase by 2D glucose 6-phosphate, and later it will not be converted into pyruvate, and hence there will be no energy release. So since there is no energy release, the cancer cells cannot grow, as well as it cannot multiply due to the deprivation of energy, and hence it leads to death of cancer cell. So this mechanism plays a major role in the treatment of cancer. It is not only used as a monotherapy, it is being used along with radiotherapy, and a lot of scientific literature says that it has been efficiently used as an anti-cancer agent. Now we can see how this 2D glucose can be used in the treatment of. Let's consider a normal cell. A person has been exposed to SARS-CoV-2. In a moderate cases of COVID-19 patients, through the oral route, we are giving 2D glucose. This trial has been done in nearly 350 to 400 people. Not more people has been experimented so far, but still in these people it gives a beneficial effect, and hence they are planning for the approval of use of 2D glucose in the management of moderate cases of COVID-19. So this 2D glucose will enter the cell, infected cell, through the glucose transporter. This infected cell, the 2D glucose enter, and which will be, this 2D glucose will be converted into 2D glucose 6-phosphate by exokinase. And again this product is going to inhibit the exokinase, and as well as it's going to inhibit the glucose 6-phosphate isomerase. It's going to inhibit both these. This product is going to inhibit exokinase, as well as it's going to inhibit glucose 6-phosphate isomerase, and hence there will be no pyruvate formation and there will be no release of energy. Since there is no release of energy, this infected cell cannot be multiplied. It cannot be multiplied, and hence this infected cell will go for cell death. Infected cell goes for cell death. This is the strategy. They are going to use this 2D glucose roadblock for COVID-19 progression. There is one more advantage of using this 2D glucose, because for all the steps of glycolytic pathway, more amount of energy is needed by an individual. For any glucose to be broken down into pyruvate, more amount of oxygen is consumed by the body. Since this process has been inhibited by 2D glucose 6-phosphate, it doesn't need more of an oxygen for this process, and hence that oxygen can be utilized for the patients who have been suffering from oxygen deprivation by the body itself. When you use a 2D glucose, there are a lot of side effects, not life-threatening, but a few adverse effects like fatigue, sweating, dizziness, hypoglycemia can be experienced by the patient who are taking 2D glucose. So the take-home message is, 2D glucose is a modified form of a glucose. It is taken in the oral route in moderate cases of COVID-19 who needs oxygen. So it has been acting as a roadblock in the progression of COVID-19 by the mechanism of inhibiting the glycolytic pathway, by ultimately leading to infected cell death, and also in addition the oxygen dependency of that pathway has been reduced. So by these mechanism, the 2D glucose has been used in the treatment of COVID-19. Since it is used only for 300 to 400 cases so far, it needs much more scientific evidence to support the usage of 2D glucose. But if this proved to be a roadblock for the COVID-19 progression, and it would be a turning point in the management of COVID-19 cases. I hope you like this video. If you like the video, kindly like, comment and share this video, and subscribe to Dental Shots for the further notifications of new videos. Have a great day. God bless you all.